Well, sadly, the news out of Georgia is all too familiar. A couple of years ago, the CDC first reported that gun deaths had surpassed car crashes as the biggest killer of kids and teens here in the U.S. Now the CEO of Children's Minnesota is pushing for more solutions. Kent Erdahl spoke with him today about it. Kent?
Yeah, Dr. Mark Gorlick started his career as a pediatric emergency room doctor where he saw young victims of gun violence. And after that CDC report in 2022, he joined other local hospital CEOs in declaring gun violence a public health crisis. But after seeing little change since then, he's written a book with his ideas on how to tackle it. Whether children are shot in a school in Georgia, a stolen car in Minneapolis, or a home anywhere, it takes the CEO of Children's Minnesota back to his time in the ER.
You don't forget those images. Those patients have stayed with me for the last 35 years.
Dr. Mark Gorlick says the feelings are frustrating and familiar.
I think part of what makes it so gut-wrenching for someone like me is understanding that it really is preventable.
He offers his prevention plan in his new book, Saving Our Kids, an ER doc's common sense solution to the gun crisis.
The goal of the book was to paint a picture of what would it look like if we acted like this is the public health crisis we say it is.
He says that begins by fighting the urge to run to our political corners after every mass shooting.
Too often we frame it as a moral issue. Either you are a bad person because you have guns, or you are a bad person because you want to take away somebody's guns. It is not a moral issue, it's a health issue. It's the leading cause of death in children. Think of it that way.
That, he says, will require cooperation between healthcare, governments, and individuals on mental health and gun policy, education, and community interventions.
I think a nice example here in the Twin Cities is something called Next Step. People who are victims of violence who come into one of our emergency departments are connected with resources to both support them and their families in the immediate trauma, but also to intervene to help prevent them from getting re-injured. And it's almost 5,000 children and adolescents each year in the United States die of gun injury. Every one of those is a tragedy. I know how difficult it is for our staff and for their families and for the communities. And I know that if we take the right approach, we actually can do something about this. This is not an insolvable problem.
Dr. Gorlick's book is available right now online, and all proceeds from the sales go to support violence intervention programs at Children's Minnesota.